Abishia Mubiem, Meda Health, any Women Ministry Department, I say, Wakwenya, Omodia Mamma say, ne, Menemo Meka Bibi Kakra, and Mudem. Enti, Yancha Hono, Yebeka Safa, arthritis home, specifically rheumatoid and osteoarthritis. Both conditions, a form of arthritis. Nti yɛka arthritis koraa pa a ɛne ne dɛn. Arthritis inflammation anaasɛ swelling of your joint. Na wo joint so ne dɛn. Wo joint yɛ where two bones meet. Na yɛwɔ different or many types of joints in our body. Na so obinya arthritis it causes them pain. Afei obi koraa deɛ ne nsa no ɛhonhon na movement it becomes very limited. And as a range of motion koraa no ɛyɛ na ɛho ayɛ den yie ama obi a ɔwɔ arthritis. Rheumatoid any osteoarthritis ɔmo wɔ very similar and as a overlapping symptoms abɛka sɛ ɔmo yɛ the same. Nanso nsonsonoeɛ ɛwɔ ɔmo mu in terms of the way they present, and as a symptoms are obi wɔ rheumatoid or no a different from nyawo osteoarthritis. And see, chair no. Chair hono measure free rheumatoid arthritis. Rheumatoid arthritis a chronic, meaning a lasting. So when you're for life, inflammatory disorder. Na we to me see when one kasa will own body no, and I say one kasa will own immune system no, mistakenly attacks your body cells, and I say tissues in your joint. Na say it makes the joint swollen, stiff, and painful. Na the crop pots and pie de by the ye even though one kasa body immune system it's think of a problem brow. By the crop pot and pie de bano, ye nim shushemu amaye who say maybe genetics predisposition in addition to environmental triggers be and I bit to me amawanya problem. Rheumatoid arthritis and I say RA utminya at any age. And cracker to minya arthritis. Now, mostly, no, you between age 40 and 60. Onset, no, a bit very slow. Obiso high to me, but suddenly. And a year 2 to 3 times more. It will mamu, die, and mama. Now, so be RA, and I said rheumatoid arthritis, symptoms being cry, na ABI ubi home. So at first, no. So be this conditioner, they might start experiencing painful and swollen joints, especially a omonsa, wrist, feet, and I say knees. Obisu why to me red and puffy. And some of the early symptoms, no so a bit of fatigue, weakness, and I say even low-grade fever cry no a bit home and weight loss. Ulusu weight any intentional. Or no singing a bit symptoms in the home. Now about rheumatoid arthritis, any osteoarthritis and so about a da mumu a year with rheumatoid arthritis no. It comes with joint pain and stiffness, even when you're not doing anything, or to hold at rest. Unlike osteoarthritis, it drew a mechanism. Now, stiffness no with RA, and I say rheumatoid arthritis no, it lasted more than an hour after wasori and opano. Now, it to me affected several joints in your body. And see, unlike osteoarthritis, rheumatoid arthritis, it to me say if you unya sa condition so it's me go to dream you at the same time, and I say your wrist it's me attack both wrists at the same time. Over time, no, it's me affect the other joints in your body, because say jaw, your shoulders, and your hips. It's me money so difficult, and I say it becomes hard for you to even move around. Now, another difference is that what rheumatoid, any osteoarthritis here, the systemic symptoms are RA no one. Inti RA, it's me primarily no, like I say, affect joints, but it can affect your whole body, including your eyes, your heart, and your lungs. So I had a friend, na me wadam phobia na on him or one day or sorry afei nani baako na ohun adeɛ it was so red nani ne pun so too much and she was able to see eye specialist that day ɔmo de ne to aduro so ɛkɔɔyɛ ɔwurie no the same problem came back again nti na ɔmo nhyɛ dɛ ohun ade koraa ɛkɔɔso ne eye problem ne saa but to cut the long story short we found ourselves I know RA and I said rheumatoid arthritis. And this was it was the reason why I not nanino onya problem ewo nanino. So to come back to what I'm saying, when you have rheumatoid arthritis, it can affect your whole body. So it's not just the joint. Now, in severe cases, over pictures here wobɛtumi a experience bibi a friend rheumatoid nodules nti wei I say hard lumps and I say bumps are it happens under your skin ohwɛ picture yeah me me left yeah so this is in the severe cases and on my right I have a picture of early someone with early rheumatoid arthritis. You see the redness, that's the inflammation, it is painful, was that affected joints, intermediate, middle one, if I say progress, that's what you will see, say, it happened, and my far right, so on it there, I drew like severe stage where you have contractures, don't to me moving on Sanakra, things becomes very limited. So we'll get it to that stage now. Enti yetwa so no yebe kasa kakra afa osteoarthritis. Osteoarthritis sometimes is called degenerative joint disease, and I say wear and tear. It means a type of arthritis it happens slowly, and over time, it gets worse. So both conditions, once you have it for life. Way a progressive, it gets worse as time goes on. Now onset also a very slow until obi betimi arthritis in their 20s and not even have any symptoms. I feel only nkwa animu na ahye eyi ne ho adi nkakra. And osteoarthritis is the most common type of arthritis that affected people in different ways. And see, one major cause for this wear and tear, wear and tear from things like activities, and I said job that are physically demanding, and I say injury and trauma to the joint, and a secondary cause for this has been associated with infection, genetics, and I say metabolic problems. Now, disease process for osteoarthritis, normally, sorry picture me me slide. So I have a normal joint and then someone with osteoarthritis. Normally, you will cushion layer, your friend, cartilage between the joint. Now, this cartilage, you may say, it acts as a pad between the bones of the joint. Now, cartilage in a bois. Our joints move easily and comfortably. So in some people, the cartilage thins out. It becomes very thin over time. And so we use our joints, for a long time, it becomes very thin. And this is the start of osteoarthritis. Over time, the cartilage will wear away and break it down. And your bone will start rubbing together. And to say, picture me on my right, far right, now redness now, that is the inflammation now. Make come no. And see when your bones start rubbing together now, it causes pain, it causes swelling, and a bit decreasing range of motion. I say even movement, it was affected joints, And see normally people who play sports. Enya condition way a lot because sports can be hard on your joints. And with this condition, so no, utiminya unfie kwa animu no. It occurs with age. Unye no, it puts you at risk for that. And we saw like rheumatoid arthritis, we so see or mamu more than a mema, especially middle age, any 50 years, call nanim no. And see, unlike RA, no, and I said rheumatoid arthritis, no, we need a non-systemic disease. And so you'll be a osteoarthritis symptoms bang cry and now be home. This can affect any joints in your body. Well, a bit to say or cervical spine, or chi, or neck, or chi, or and lumbar spine, lower back, or hips, or knees. Ningina affect the whole. Now, so unya osteoarthritis, or wrist normally no, will joint a connective bone na a wo cochromatino to your wrist. So when you osteoarthritis it becomes really hard to even grasp and I said pinch. Nti ningina can symptoms no wa obinya osteoarthritis ewo ne wrist or be experiencing. And there is a decreased range of motion in the joint. So, for instance, no weight-bearing activities, they say, or call up the stairs, and I say even coming down the stairs. What's not getting up from a sitting position, and I say even nante prolonged standing. What you know, no, obi war osteoarthritis, it becomes really hard, and I say it becomes a problem, and osteoarthritis, no, so being osteoarthritis, ewo ne hip, that can even go to the groin. I say corner say now call the butt, and some can even radiate a bit more travel to your knees, which will make movement also difficult. And see, like I said before regarding stiffness no it lasting more than an hour. With osteoarthritis, no, osora no pa, yeah, you get the stiffness, but it lasting more than an hour. And even though at nighttime, the stiffness will resume, towards the end of the day. And I say after a period of activities. But once soon, yeah, what we need back when you say stiffness no and lasting more than an hour. And see, also, for osteoarthritis, a progressive and as a degenerative problem, no, it gets worse over time. Without treatment, and I say, if your symptoms are not well managed, you can your condition can escalate to that level. Say now this can be physically disabling, like because it comes with pain. It impacts the quality of life a lot. And see, makasa both conditions wenya and are no on it o body nankasa cry sometimes o body nankasa na pen to kwana and that's a problem no edema. But there were risk factors be a increase your chance of getting these conditions. And a bit to say being over when we say your weight anymore. So if you have arthritis, it makes it worse. Now, it puts you a lot of pressure. So arthritis now it will hip, and it will knees, and our spine, it puts you a lot of pressure on these joints. And also having a joint injury. So joints are injured, and I say damage. And I say whatever condition or more near the steroids injection for a long time, it may cause it increase your risk of getting osteoarthritis. And repeating movement at work. And see people who have a pneuma, it requires the same movement over and over. So like painting and also lifting, it puts you at high risk of getting these conditions. And being older, and I'm a kind osteoarthritis, because in older people, no, or more used to or more jointing for a long time. And that also puts you at risk. Or your ban, so it puts you at risk for getting these two conditions. And family history also plays a huge role. And see, in terms of treatment, today no men can a draw be far, and as I'm not recommending say for a draw. If you have all these symptoms, no one will provide and casa. I'm sure they will help you find the right medication for you to manage your symptoms. But I send back one and person make in terms of treatments, and I say treatments they individualized. Obia treatments no ain't yet the same. But it's very, very important since these conditions I'm me inflammatory. It comes with pain, swelling. Until you be a ne koto dre ni sisi ne ya na wakofa kakabra kofa adro it is ibuprofen, Aleve, Motrin, na wanom. Ibuprofen falls under the class and class called NSAID. Now, these drugs no also over the counter when you have prescription and say you have easy access. But I say, oh yeah, very, very careful. So we will be able to take ibuprofen or Motrin, Advil, Aleve every day. And yeah, cry. And she more my who said taking ibuprofen every day, and I said NSAID, and increasing your chance of getting stroke, and I said heart attack. Ibuprofen, it's me ma secondary hypertension. And then hypertension are drawn the amount. And as our hypertension cry, and I say we take all these NSAIDs so it's me increase and as it makes your hypertension worse. Until that part is very important. And I say ye. And taking ibuprofen, it can cause stomach bleeding. I feel with many also cry. And it's very, very, very important. So, pain all the time. For hospital or talk to your provider. Now, I'm find the idea about to manage the pain aside from the NSAID class, And in terms of NSAID, there was topical form. It is a Voltaren gel. Well, we say even though a gel, but using it more often, it bit might produce the same effect as taking the oral, no. And say, yeah, dear, 2 minutes, be an hour coffee, baby, a year, no. And we also have capsaicin gel. Ono has been proven to also help those with osteoarthritis. But with this one, it comes because it's derived from chili pepper, and see it comes with this burning sensation to it. But one more use to say a boy to be no provide a casa say or no ebe boawa. And so even if you decide to take NSAID purple was short acting and long acting form. So instead of taking ibuprofen, maybe Aleve, because Aleve, side effect to a less side effect. And some people also take nutritional supplements or more osteoarthritis, and I said rheumatoid, they take nutritional supplements like glucosamine. So that supplement and your FDA approved. If you decide to take provide and casa say then you take it because whatever you put in your body, will consequences. Okay, so for rheumatoid, any osteoarthritis, the go no for treatment, and you say to yare na call, but the go on the pan is to relieve the symptoms, reduce pain, and also prevent future damages and improve quality of life. And see, for rheumatoid arthritis, since it's caused by your immune system, they might put you on immunosuppressants because over this condition now, your immune system is out of control. And this medication can help you bring it back to normal. They might put you on steroids and all these other medications, I said, if you qualify for it. In a worst case scenario, surgery won't. Hip and knee replacement could be a suggestion too. And what are the non-pharmacological intervention to manage these symptoms? And see, we can implement complementary therapies. Therapy, say acupuncture, Tai Chi, and I say yoga, ningina can help with the symptoms. And now we can apply heat. And see, one way to apply heat, is to take, so these are when, um, these interventions when you having the symptoms say or flare-ups or sad pain now you can apply heat, and one way to apply heat is to take 15 minutes hot shower and answer bath, and then you can also use heating pad. With that, be cautious of that now one or baby, because this method it will help relax stress muscle and also it will decrease the stiffness. You can also apply cold. And see, in the case of acute pain or for osteoarthritis, you can apply cold because cold inhibits normal pain. No? And cold treatment includes using ice packs, and as a soaking that joint, affected joint, and AOCC, it will be hard to do that, but you can use ice pack for that. Soaking that joint, in cold water. Now, with this approach, so bad and as a poor circulation, I wouldn't advise you to use the cold method, no. And reduce the stress on your affected joint. And see, to say, yeah, Juma, like job that are physically demanding, and try to reduce the stress. And one way we can do, and I say multiple ways, a bit to my cry, using assistive devices. And say, yes, so we use to cane going up the stairs, please do. And you can use walker, fear, a bit wow. And it can reduce the weight bearing load, from painful joints. And stretching is very, very important. And you provide a kasa say what are ways to stretch. On the print it, they will give you a printout on ways to how to stretch and do like things like wow to help with the stiffness, any pain. And you can wear picture what was slide this one. You can consider using grabbing tools, and to be a tough form use that tool to pick it up, because that will not put pressure on your back or your hip. And I said bibi will cabinets no more per sofa. You can use that grabbing tool to also do that. And more juma that are physically demanding ujina will not so for a long time. No, you can talk to your provider to give you a referral to see a podiatrist. Or they can customize a supportive, any well cushioned footwear and pabwa mawa a very comfortable with my share a word jumamu or will help reduce stress and it will affect the joints in them. All right. So now let's talk about lifestyle. And see, my cancer risk factors, weight gain, home. And see, losing weight, very, very, very important. Now, so weight, anymore. So now I can before, added pressure on that achy side joint now, the pressure, so now. Weight is so anymore. She more who say some medications they be able to take it for rheumatoid arthritis, and it becomes less effective because weight anymore, because body fat it produces protein your friend or cytokines. Now these cytokines more promote inflammation. So losing weight will really, really help. And so we'll add any extra weight will be put it on increasing load across so we'll go to when your issue is affected now. Increasing load on your knees 3 to 6 folds. That's a lot. And reducing weight, and I say losing weight, it will help you reduce the stress on the affected joints, and it can improve your movement and also range of motion. And see, then I bit my to help us lose weight. It's important to stay active. And I know that this condition it comes with pain. Why are you expecting them to go work out? Well, it's hard to do that. But one thing is that if you don't move those joints, and as a woman active, the muscles around that area, it becomes very weak. Now it will cause the joint to work less effectively. And it's very, very important. And also, it will make that place, no, that joint that affected, no, harder for you to even move around. And see, this will cause even more pain, and the cycle begins all over again. And see, a good say, you be implemented gentle exercises. Make us a gym kutu 15 minutes walk. They say the exercise they will be crowd by YouTube. Well, when you bet me there two phone so utifie, you can do it. You don't necessarily have to go to the gym. However, by cry no, you can find videos on YouTube. A beb wow, I be my wire active. It will feel because the exercise it will strengthen the muscles around that joint. You know, now it will make the joint more stable. Also, you can talk to your provider about getting a referral to see a physical therapist. Also, Bema will exercise ubetimaya ebeboa because that will include like muscle strengthening exercises. I also betimabo to reduce the pain and the stress that comes with arthritis. And see, Cinemaka been stressing on losing weight, any exercises. I mean, cause don't overdo it. I can't before, and you don't have to go to the gym and run for 45 minutes, even 15 minutes every day, just moving those joints, you know. And I say, bit to me, try to avoid inhuma and I say activities that it requires repetitive movement because you add stress to that joint. And see, another lifestyle changes are able to media kind your daily routine, no, say eating healthy and having healthy diet. Very, very important because whatever you eat, if you take care of your body will take care of you. So whatever you eat, and then now say because a wound dear healthy, now you're how is your body gonna fight against this condition? Nti ɛsɛ nea wode kɔ mu no wohwɛ ne yie paa. Nti nnuane bi te sɛ okay, let me back up. Diet no will not cure this condition, but ebeboa making the right food choices no, it can help control this inflammation, which is the redness, the pain, and the swelling that comes with these conditions. And implementing a healthy diet is very important as well. And see, nnuane a bit say fish, right? Salmon, tuna, sardines. Because fish, are very high in omega-3 fatty acid, which can also help control the inflammation. And fruits and vegetables. And see, fruits and vegetables, very rich in antioxidants, right? So, which will help to stabilize. So, there is a molecule called free radical, a trigger inflammation. And see, a trigger inflammation to me damages cells also. And having fruits and vegetables that are packed in vitamins and minerals, also, fruits and vegetables are what vitamins and minerals warm. It can help your body and it can also lower. There is another protein called C-reactive protein. On the advance will make inflammation. They are the maker of inflammation. So having these fruits and vegetables in our diet, it will help to also reduce the inflammation as well. And they're very important. So eat a lot of colorful variety of vegetables to get the most nutrients. Obetimia aim to for 2 cups of fruit, and I said 2.5 to 3 cups of vegetables per day. You'll be onye active. Now, so to me exercise, and I said 30 minutes a day. Measurements to me are reducing it kakra. And also whole grains. Whole grains are very important as well. And see a bit to say oat, whole wheat, quinoa, and I said brown rice. And our whole grains, it can lower your levels. When we say C-reactive protein, or your maker of inflammation. And see, implementing this whole grain also be able to reduce this job by C-reactive protein. And it can also help you decrease your risk of getting heart disease. Heart disease is so very high, or more rheumatoid arthritis. and peas and beans. So these legumes are, including black beans, garbanzo beans, red kidney beans, black eye beans, a good choice. They are a great source of protein and are very important for muscle health. And see, normally, or more rheumatoid arthritis, no, they are prone to muscle loss. And see, eating these legumes, wow, a lot and nuts. So such as pine nuts, pistachios, hazelnuts, almonds, ningina bois. Walnuts, dear cry, dear, almost say very important for those with rheumatoid arthritis because a high in omega-3 fatty acid and ground flaxseed and also another good plant source of omega-3 also dear a bebre. But like everything else in life, don't overdo it because if you not even though more healthy fat, but they also are high in calories. So if you're trying to lose weight now, you won't go overboard with these. And last one, no, yeah, olive oil. And I said avocado oil, and also very, very good. And see, to say Ghana for stew, no well, you don't want me use olive oil for that. Avocado oil, you might be able to use avocado oil for stew, and as I did BC just what heaty for a long time. So using olive oil, no, instead of all other oils and as a fat no good because in addition to healthy monosaturated fats and it produces it contains this compound that, and I'm talking about olive oil, it contains this compound that also to me reduce inflammation. Now who said this compound in it to me acted like ibuprofen in improving pain, which is impressive. And send I can before for the nuts, and also eat in moderation. As with all oils, a fat, now it can lead to weight gain as well. So also dear now and also the caution at home. And see, to wrap this up, both condition a lifelong disease when you for life, but you can manage the symptoms. And we might be able to treat it and also or provide a bit much treaty, which will go away for a while, but it will come back. And see, important to see your doctor as soon as possible. Say, oh, symptoms, yeah, making be and also already cried and I said, no, now that's so no. O think I say and want what jai you so it's not a good idea. Go see your provider so maybe they can change your medication to something else. And because some of the damages are these conditions, the but say RA and as a rheumatoid arthritis, some of the damages are irreversible. And so finding the disease and treating it early is important. And the earlier you start treatment, the better the outcome. So I would like to read something from Exodus chapter 23, verses 25. Or says, I assume you're ready, ye obɛhyira yɛn nnuane ɛne obɛhyira yɛn nnuane ɛne yɛn nsuo so na obɛyi yarewa nyinaa afiri yɛn mu. Amen. So mede ma no bɛsi as obi wɔ contribution and as questions this will be the time.
Amen.
Amen.
Dr. Mpacho Mewoso.
Mpacho Anewoso.
Nyamisha opa doctor. Me pacho wo me pese me bisa se ye betimi ato vitamin D for bones so ana any calcium na abra ye di beans ni ne ye exercise no so aka ho na na pacho masin bisa no das.
Okay. So it's not a bad idea, right? But when we say that like everything else, you don't want to overtake it. As long as it will take it the right dose, and call hospital to follow up with your primary care provider. So momuhunia will take it. Well, now they can advise you on it based on what you have going on. Pacho, me answer our question.
Patra medasi. Misha.
Amen.
Hello, Mpacho Moso.
Mpatwa.
Mpacho, that was since me. My question is, fibromyalgia, any RNA or no, it has any similarity, yeah, symptoms.
So I will just touch a little bit on the fibromyalgia. No, or no, your whole body. So symptoms are, a condition that they can pinpoint at the crop protein air coso, right? And it's even hard for a lot of providers to even diagnose that. A pain, so I said, uni, a pain, like uni chemokra for that. So someone with osteo, and I said rheumatoid arthritis, in combination with fibro, has a lot of things going on. But though.
But it seems like I said, it's in Suya, but symptoms, the way I see describing now, I say the same with mommy. I'm not trying to challenge it, but difference crowded naturally difference or what fibromyalgia and what side them.
Okay, so with the fibromyalgia, and I make us say, oh no. So let's start with rheumatoid. Rheumatoid say, right? Is the joint over time, then maybe it can affect other places. Fibromyalgia, it can happen everywhere at the same time. Does that make sense?
Yes,
will show this like you'll be experiencing pain, constant pain everywhere at the same time.
Yeah. Okay. All right, Martin.
All three conditions, so not me first, overlapping, and that's the similar symptoms. Because you're the same. And see, baby to say that rheumatoid arthritis is stiffness. Stiffness lasts more than an hour in the morning. Okay. This condition, right? And as a less than an hour, unim say, okay, it's not this. And but even though it's all joint problem, and they might have overlapping similar presentation. Mm-hmm. I hope I'm able to answer your question.
Yeah, it's enough. Thank you. That's
Obiso one more, I'll bet to me about there.
Your dog, but you mean said a young arthritis, in America, one way prone to it, a car about female, why more prone to it now. Maybe said, is there a racial component to that? And say one race be winning chain, other and if so, why now urban them?
Oh, so in terms of ratio, I think it happened to all the I had to say I'm trying to say hypertension, which is more in Black people. This condition, white it's me affected. So it doesn't have a racial component to it. With a mano, regarding to it happened to a man more than male, I think the hormones also play a huge role in that too.
Okay.
Any other questions on our contribution? We still have some time left.
My other question in there, them two types in a handy now or attack who cartilage anymore, and then now it's based on a degeneration of a cartilage.
Yeah, it's based on that. And see, even with rheumatoid arthritis, right? There were different types of it. There were negative, there were negative and then we have positive one. So with my friend example that I gave, we find out say, oh, rheumatoid arthritis, no. Even though she didn't meet all the markers to get all the markers for a traditional rheumatoid arthritis, but because of some her FRBB ESR, it was elevated. Some of her lab count was elevated. And so more diagnosing it with rheumatoid arthritis. Am I making sense?
Yes.
And you know, it depends on the level. Oh, it depends on the level. Some people have it like severe. Like late stage na yebe hu. Early stages na yebe hu. So it depends on the level.
Yeah. And I heard some maybe there more from the weight of their backpacks now then can actually lead to these things later in life. How true it is. Now the second question is them use of insoles now, shoe inserts now then. How helpful are they to we are stabilizing in that manner, minimizing the effects of these conditions?
Okay. So in terms of Nkra, no, Nkra can have arthritis too, but I don't know about the backpack. Honestly, I haven't read about it, and maybe I have to go look into it. But Nkra to me, enya arthritis. And talking about supportive wear, no, they can customize it to your size. Well, should be there, but should be there. My who say a lot in terms of arthritis ne wo nan mu and I say nine well a lot like with pain and also moving around and also boa ye bebre from people or more should be that though.
Yeah, that's
Me pacho doctor we the one can once and by me pese me bisa to say umu tenya frozen shoulder pain no me pacho se ni nyina keka arthritis ya wo kan once ni bi ho no pacho say no be type na.
No, there's something called impingement. Well, nerve impingement. Ningina a different. So the one there are a lot of conditions. I bit to see from your shoulder to your back. Arthritis bit to home. And I saw ubit arthritis from these conditions that ebia no ebia trauma accident to be see unya dislocation when say dislocate will show that over time no you can have degenerative arthritis or that side and frozen shoulder is it from arthritis depending on what the problem is and I said I declare cause no.
That's
Okay.
You doc, okay, go on. Maybe about these supplements we're advertising there or help with cartilage and all those things to minimize how effective are these and those one of those camps in Azina.
So I didn't really advertise it. Not make us say people take it. Now, so your more, if you're part of that group, or for these supplements now, just make sure so you follow up with your provider because some of these meds and as medications are all no, I don't know the medical condition or bit my contraindicated to other meds are offer. And so now I was just providing awareness and education says that who decided so fast supplements. No provider and kasa say ebeboa adrokra order so no is it going to help? Should you take it for this long? Because you don't want to take it for more than 60 days. So we know doctor and kasaya and I say for a long time because ningi our consequences are a bit media bro.
Thank you.
Doctor, yɛda wase bebree wɔ adesua a Nyame nam so ama odi abrɛ. Na me nso masɛm bisa ne sɛ, wosɛ to da na ona ho asɛ bɛn no ona ho ɛhyehyɛw. Ona ho hyehyɛw kakra. Ɛno no yɛ arthritis anaasɛ ɛno nso so n'asɛm ɛnko.
Ono so na some bit to my and so onine show no, does it come with numbness? And I said tingling. And I said a dent now onine show, because that could be more of neurological issue. You might want to see a neurologist for that. But you sent me to me answer a question no.
Me patcho say.
Now maybe say onine show no. Does it come with numbness, tingling, and as any other symptoms? It should show like then a man. Okay, so with burning, no,
it doesn't come with that.
Okay, so with burning, no, it could mean a lot of things. And see, normally, so they call a doctor and they're not trying. So who are they will refer you to a neurologist to see because you're more specialized in stuff like that.
And I'm Pacho, maybe some question about Hello.
Auntie, I'm a bit makasa.
And I'm person some question for the obisa no say tingling no numbness no. A bit more symptoms of fibromyalgia. Now say as she has a different thing,
So fibromyalgia, auntie, are huge. They're kind of saying primary care physician doctor will not even diagnose you. They will have to refer you to a rheumatologist because hormona they know more about that condition. Tingling can be part of it, and I make kind of fibromyalgia is not just one part of your body. It's tenderness, pain everywhere throughout your body. And you know, they will do all these. You can just to me and diagnosis will be based on physical symptoms. On by your lab work or mobile, they will do all this diagnostic testing a bit for them to conclude say, oh, fibromyalgia, and I say only fibromyalgia. And numbness, tingling, it comes with nerve, right? So that's nerve condition. I also neurologists also bit to my boy or more what is going on. They have different tests that they also do. A bit to say, there's a test called EG. A bit more your neuropathy. Are you having neuropathy and I say radiculopathy? Whatever problem now, they will be able to tell you more about it. It's not just any more like subjective. Then they will do more tests to find out what's really going on.
And then let me be certain there. I know, sir, it takes a long time for them to even get the diagnosis for fibromyalgia. And in person who said finally, so who say you have fibromyalgia a day any day no moody Gina Suka so maybe any pani will be.
Diagnostic test, the lab or a whole list of lab, auntie, and you're just one test or mobile. It's a whole list. And then say fall into the checklist and now rheumatologist never then they diagnose you. But fibromyalgia no is so I worked with a rheumatologist for a while. And like I said, in his career, no, why Juma for more than 20-25 years. Wait, my guys, why diagnose with that condition, no? Because they'll do or bad mistakenly, no, or more diagnosing, even though Nisa, or Nisa problem, no. But based on your symptoms and the lab work and everything that they will do, no, on the bema, or be concluded to that kind of diagnosis. And it will be managed by them. It will be managed by rheumatologists, not a primary care physician.
True.
Doctor, and the okay, BM said fibro near okay no and yet very common. They said the other ones now walk no. But Abekas will be a call and also pa and you know my june kakrane say unipa cross said your how no TBR like she's repeating herself said see your primary physician say be ya obeboa. Doctor, my question is say enti se ujina enten sa ti se omo ye nurse si ujina wo 12 hours ni wie na na mhihye ho a leto bia wo fi a ona mo hihye ba obejina enten no ana afi ona mhihye ebasa mpacho den na wo se oye can you say e enten nyina no na deba ana se wo se utumrika ko hu doctor.
So
That's it.
Okay, thank you, Auntie. It depends as these symptoms not a consistent, right? So once in a while they're okay, but you're consistent and you keep getting this burning sensation now. Okay, the burning sensation is, where is it? Does it start from your heel going to the middle part of middle part of your foot now? Because honestly, yeah, another condition, plantar fasciitis, and I said something else. And to say, oh, problem no continuously, I will go see my provider. And or you can also try the cold method. You can soak your feet in cold water, because like I said, cold numbs the pain. If it helps, then say me go jam and now so no, and yeah, cold can help. But so I try all these remedies and it's not helping. I will talk to my provider. Just to add on, some people have flat feet. On the nano or the siwa, say omo flat feet no more arch kakra ewo omo nani say bubu and nano see flat on the surface. That can cause a lot of problem for you. And also say I'm a kind, you can talk to your provider, they will refer you to a podiatrist and they will customize this shoe that can also help with the flat feet, it causes pain and I say for so.
Thank you.
All right. I'm not sure I can in 1 minute, but if there's anybody that still has a question now, we can still take questions. Mpacho obia any questions bia ene mpacho ye di program no ebesi I say ene Dr. Unity da wasepa se ene wadi anim with this program I chat about arthritis no insure pa. I hope say I a bad line you soon no yenya good information ye debe you saw your daily lives more. Now, if you have any problems with these, I'll wait me a call of primary care doctor honum na so I get some more help. Yeah, a bad line you so you say and then so you take your time about program maybe Yankopon insure and branding BT programs maybe because they are all very educational and they are very helpful. Questions and contributions about so that nina asset. Let's also take this opportunity to add that Yonkodoradio for us so every Sunday be a mobile ever record program no my now record there as it's going on Zoom so it's being live streamed on YouTube till more money Zoom soon and they could be on YouTube watching it. And it's also going to be available on YouTube after the live stream now. Recording is here ready. I'm send it a call Queens Women's Ministry WhatsApp page and so into a moment me and you could refer them to the YouTube channel and I say the link in the Queens Women Ministry WhatsApp page you could send a link from there to them no more submit me at your program nibi and sharing na and patrol ye be free I say no Emma Patricia Owusu se baby I want to patrol with me abo in closing prayer mayena. Okay. Ye mame Patricia Niswa. Ye mame Felicia Ajay. Se baby a woni ya mpacho betimi abɔ mpa ya ma ya close ya.
That was ntumfo. Papa ehia wo ma na wa wade adum yen ne dai. Urade wo ma edu stage bi na ya yade ayen. Nso na wada wo ma na mafra waso. Ama na kyerɛkyerɛ yade na ni so sɛ ne bɛyɛ a. Yenso benya de ne de asom wo. Da was papa. So hu ye mbɔ sɛ na wado yɛ tie. Urade sɛ waba wanso de ne. Ndia wo de adum no urade. Nyɛ wani so adi hu a bɛboa na aboa afoforo nso bɛboa no nso no na busua sha no na sha ho ni nyam e betie nyina awurade atie yi emfanya dwuma nti mo aye wenda achie brabom sɛ ade ha ye ne ba enu nyina mu ne yankasa yɛsɛ hu sɛ ne abrabɔ ne kɔ na yɛsesa yɛ didie ne yɛsesa yɛ abrabɔ sɛ ne bɛya ebetimi anya ne daso pa wonyame mu onyame ne ayare safo ti awurade Mama mo boss na wado yeti nhyira yen ne dai mo ho ban na ne ekoso ye brabo nyina ho ye fi ho ne nya ho de asom papa bo ne se hyira yen nyina wala yesu ntimi kasa ne ntimi nkasa yesu di nhyira yen na me asesa yen jojo wa ha ya wi na brabo nkoten wo wadu di no e bo ne se na nyina yesu wani hyira yen e bo yen e fi wani mu ewra do ka yen ho nti bo bi biara se na wado yeti wo yesu di no amen